So my slides are visible and am I audible to you? Let me know whether I'm audible or not, my slides are visible or not.
Yes, ma'am, you're audible.
Okay, so now we can start because we have to discuss a very important topic today. So we will revise a little bit through different multiple choice questions. So the first question is, which genus of bacteria is significantly increased in obese individuals and contributes to energy harvest from the diet? So which of the following bacterial group you expect that it will increase in obese individual? If it is obese, then which bacteria will increase in the obese individuals? Bacteroids, firmicutes, Akkermansia, Lactobacillus. So we all know F by B ratio. So firmicutes will be increased in the obese individual, and they are known to derive energy from the polysaccharide we consume through our diet, normal diet, whenever we take. So it derives energy from polysaccharide. How it derives? Because it secretes hydrolytic enzymes. So the complex polymers are converted into monomers, and monomers and energy. So this is done by firmicutes. So you can expect the increased population of firmicutes in the obese individual as compared to the lean and thin individual. Now this is the next question. How does gut microbiota influence type 2 diabetes? By increasing insulin sensitivity, by increasing glucose uptake by cells, by synthesizing insulin, by degrading pancreatic beta cell. So what phenomenon is adopted by the gut microbiota, which will influence the type 2 diabetes mellitus? So in type 2 diabetes, we know that insulin resistance takes place. Insulin resistance takes place. So we have to make our cells sensitive to this insulin. We have to make our cells sensitive to this insulin. So what our gut microbiota do if it is altered or if it is in a good condition? So it do by decreasing the insulin sensitivity, because in a good condition, in a normal condition, our cell should be sensitive enough towards the insulin so they can take it. Insulin, we have different blood transporters. So we have in a normal patient, the sensitivity towards the insulin is high, so that they can convert the excess of glucose into glycogen. So the condition which do this thing, alter this thing, is dysbiosis. So in dysbiosis, what happens? So in dysbiosis condition, or the bad bacteria do what? They reduce the insulin sensitivity and they promote type 2 diabetes mellitus. Now, third question. Which microbial metabolite is known to improve insulin sensitivity and reduce inflammation? So we have already studied about this in a in various classes. We have studied about this fact, like gut. Anybody can answer. Gut microbiota synthesize what?
short chain fatty acids, butyrate.
Yes, short chain fatty acid. They synthesize acetate, propionate, butyrate, and through that they can improve the insulin sensitivity. Opposite of this question. If your gut microbiota is altered, they will decrease the insulin sensitivity, and if it is in a good condition, they will improve the sensitivity and hence the performance towards the insulin. So short chain fatty acids do this. Short chain fatty acid like butyrate, propionate improve the gut microbial population, and they will behave like an anti-inflammatory molecule. So they will improve the insulin sensitivity, and hence they can contribute in preventing the type 2 diabetes mellitus, which is caused due to the increased insulin resistance. Now, which mechanism best explains the gut-brain axis in neurological disease? So we have studied about this yesterday. Which mechanism? We have studied about several mechanisms: direct bacterial invasion, bile acid conversion, vagus nerve signaling, and microbial metabolites, production of digestive enzymes. So it is the
Vagus nerve.
yeah, right.
Vagus nerve signaling.
Vagus nerve signaling and microbial metabolites. So you all know that we have different factors which controls our neurological condition. So whenever we are having a good bacteria in our gut, they will overall control different axes like gut brain axis, gut pancreas axis, gut liver axis. So if they are in an imbalanced state, then there is a problem. So they will cause different kind of inflammatory response in our body, and that will be very much harmful. They can result in different metabolic disease. So right answer is vagus nerve signaling and microbial metabolites. We have studied regarding this. They can synthesize different genotoxin, different endotoxin. So what are those things? They are metabolites. Now, one more question. In diabetes, an increased abundance of which bacterial product is harmful? Butyrate, LPS, serotonin, tryptophan. So this I was talking about LPS. So we all know LPS acts as an inflammatory molecule. So whenever there is an increase in the LPS, LPS is synthesized by gram negative bacteria. It will raise the inflammation in our body, and hence our immunity will be not able to fight against the actual pathogen. They will be busy with something else. So right answer is LPS. Now, before starting this fourth unit, let me show you how an gut microbiota diagnostic report looks like. This is a sample report I have created. So you can expect this report in a realistic way. This is the kind of report which you can expect if you are going through a diagnostic test related to your gut microbiome. Suppose if you are complaining consistently about your disturbed bowel movement, and also if you are complaining about indigestion, you are feeling bloated, you are having abdominal cramps, pain, and anything related to gastrointestinal disease. So if the symptoms are like not so much, and if it is only the initial level, so your doctor will provide you some probiotics, prebiotics, and everything will be fine. But if you are having some severe syndrome since so long, so your doctor will recommend to do the gut microbiota test. So this is known as the gut microbiota diagnostic test, which is done through this one, 16S rRNA sequencing and metagenomic profiling. So what is this? This is an important part. You should know about this. I've already explained that 16S rRNA is the key to recognize any bacterial species. 16S rRNA is only specific for bacteria. If you have to identify or recognize any eukaryotic, you will go for 18S. So 16S rRNA, because this acts as a signature nucleotide. Every organism will have its own specific signature nucleotide that act as an identity of that particular strain. Suppose we all have our name. Suppose my name is Nisha, somebody's name is uh, Ram, Sham, and likewise. So everybody has its own identity. Everybody has its own genetic makeup, which makes it different from each other. We are human, but we have difference in our gene, which makes us different from each other. If everything will be similar, not similar, everything will be same, we will be known as a clone. It will become difficult to identify who is Sham, who is Ram, and likewise. So 16S rRNA act as a signature nucleotide. There are some stretch of nucleotides like A, C, T, G, C, whatever. So it is preserved. It does not change. And bacteria 1, this will be for bacteria 1. Bacteria 2 will have something else. Bacteria 3 will have something else. So through that we can identify which bacteria is this. We can identify the genus as well as species. So we have a directory, we have NCBI, and through using this BLAST basic local alignment search tool, we can identify this, that which bacteria is this, from which genus it belongs, and even we can know the exact species through phylogenetic tree analysis and also through multiple sequence alignment. So all these things are provided by NCBI, and all these things are free of cost. You don't have to take the subscription part. So this is known as the, all these things are known as metagenomic profiling. Suppose you have isolated the 16S rRNA, then you have done the sequencing part and you have sequence. So in about 2 to 3 decades before, we used to look a directory, phone directory for STD codes and number of different people. So likewise, we have a database collecting different genomic details of each and every eukaryotic species and bacterial species, isolated and identified till date. So everybody, like if I have isolated something, I will put into that directory so that it will be helpful for other people also. So it is known as metagenomic profiling. So now this is known as bioinformatics. So without bioinformatics, this thing will not be possible. You cannot even think of it. So this is known as bioinformatics, metagenomic profiling. So now see, the section 1 shows that microbial composition overview. Like they have test, diagnose the your different fecal material, and then these are the outcomes: firmicutes, bacteroidetes, actinobacteria, protobacteria, vericomicrobia. So this is the normal composition we have studied in the very first module. So what is the composition? Relative abundance in this patient is 45%, 35%, 7, 6, 3, 4, likewise. So here is the remark, because in every report, the biological reference range and everything is provided. So firmicutes are responsible for SCFA production, bacteroidetes are responsible for polysaccharide digestion, and you can expect actinobacteria have a role in a gut barrier. They act as a gut barrier. Proteobacteria, elevated level may indicate dysbiosis. So everything is mentioned here. Now section 2 has functional insights. Like this is the biochemical profile. Like this is the diversity of the bacteria present in your body, in your gut. So whether if they are present and whether they are doing their normal physiology in the body or not. So they are producing SCFA production or not. So high presence of Faecalibacterium and efficient anti-inflammatory molecules, so active, this is right. Vitamin synthesis, bile acid metabolism, immune modulation. So all these things are related to if your bacterial population present in your gut are active or not, whether they are performing their physiological mechanism or not, whether they are synthesizing SCFA or not, vitamin or not, and whether they are involved in anti-inflammatory responses or not. So after that, one interpretation or multiple interpretation as per the condition will be there. Like the profile indicates a moderately healthy ecosystem with efficient metabolic and immune support. However, early signs of dysbiosis, particularly reduced microbial diversity and elevated proteobacteria. So we have read that proteobacteria concentration is increased. It indicates dysbiosis. So what will be the recommendation? prebiotic, increase of dietary fiber, inulin. Inulin is a prebiotic. Probiotic, bifidobacterium, lactobacillus, fermented food, because fermented food are rich in microorganisms, and probiotics, and reduce processed food, high sugar, and red meat intake, because red meat is rich in food microbiology. I have taught red meat are the good source of microorganism love to grow in meat. So whenever you are consuming raw meat, it is as dangerous as if you are consuming any kind of drug, because a bacteria love to grow in high protein, high carbohydrate rich environment, and meat is a kind of food which is very high in protein, very high in carbohydrate, fat, everything. So if you are consuming that recent GBS, Guillain-Barré syndrome, which is related to the gastrointestinal disease, which was, I think, in Pune. Yes, Pune. So what was that? It was only related to the people who are consuming raw uh, meat or red meat. So if you are not cooking it properly, so the microorganism will be there, and if you are consuming it, you are providing your body with live pathogenic microorganisms. So whenever if you can compare the people A and B, if A is eating non-veg and B is eating veg, so you can expect that A will have more chances of infection than the B. Like there will be a not that much difference, like significant difference, but yes, if you compare on a comparative basis, if you want to tell, then A will have definitely higher chances of bacterial infection, because they are consuming non-vegetarian, and non-veg are the good source of food for the microorganism prefer to go in a food which is rich in carbohydrate, protein, fat, moisture, everything. So A will have, and this has been proven by research also, if you are taking non-vegetarian diet 7/7, then you will be having some gastrointestinal disease, any kind of infection in your body. So do take care that uh, try to eat properly, or a hygienic one, not from any places. So this is the report. Like you will be receiving the uh, what are the different microbial composition in your gut, and apart from this you will also receive this part, whether they are doing their biochemical profile or not, and after that your doctor will recommend whatever things going on. As per that, he or she will recommend you prebiotics, probiotics, and different antibiotic also. So now we can move to this part, that is module 4. In this we will study probiotic, prebiotic, and their mechanism and benefits, and also we will study the fecal matter fecal microbiota transplantation, and then we will discuss personalized nutrition and gut microbiome modulation if they are modulated, and then this future prospects of the therapeutics, because this is the need of the hour. We cannot go for the every time, like we cannot take generalized medicine for each and every person. We have to do some personalization as per the genomic requirement, as per the availability of the different microbial population, because the A person will not have the same microbial population as the B. Like C, everybody has its own microbial diversity. It differs a lot. So why we are taking generalized medicine? Every same medicine for A, B, and C. So how it will work? Because everybody is different from each other in terms of their genetic makeup. So nowadays, medical sciences has focused more and more on this personalized nutrition, because this has more efficiency as compared to the generalized medicine. And obviously if it is more efficient, its side effect will be low. But as you all know, it's a very tedious task to design each and every vaccine or medicine for each and every person. So obviously it will take time. It is still under development. You cannot say that for every medicine you have the personalized option. So it depends on the like disease. They are targeting the most severe disease first, and then after a decade or so you can expect that for so many things personalized medication will be available, and that will be very much efficient, and at the same time uh, it will not have that much of side effect. So as I have discussed this yesterday, I will now discuss this in detail. because this is the basis of this unit, module 4, probiotic, prebiotic, synbiotic. So the major difference is that probiotic is live. In prebiotic, we take food to increase the growth of live bacteria. We do a reverse strategy here. In probiotic, we are directly consuming the microorganisms, and in prebiotic, we are providing some nutrition that will favor the growth of the live microorganism, which will be beneficial for our body in terms of different things, like in terms of digestion, in terms of immune modulation, in terms of providing short chain fatty acid, providing healthy and beneficial metabolite to our body, which will fight against different infection, which will bring down the level of inflammation in our body. So likewise, and synbiotic is what? Synbiotic is the combination of probiotic and prebiotic. So see, this is the probiotic, which is the live bacteria. You are consuming live bacteria. Now also there are some criteria which will determine that whether you can take this bacteria as a probiotic or not. So you cannot take every bacteria as a probiotic, because not every bacteria is consumable. Even uh, if you are if you say bacillus species are generally not so pathogenic, you can consume it. So no, if it is not fulfilling all the criteria, you cannot take it. It will be very harmful for your body. It may cause different, like bacillus cereus, one of the known foodborne pathogen. So there are some criteria which needs to be fulfilled before uh, releasing it into the market as a probiotic. Now we have prebiotic, in which we take different kind of food material, different fiber rich diet, vitamin and mineral rich diet, so that they can increase the growth of good bacteria. So this probiotic and prebiotic synergy, or the combo of both, are known as synbiotic. You can see here through this diagram, we are having consuming live bacteria also, we are consuming food also. So the combination of both pre and prebiotic are known as synbiotic. Now both this probiotic and prebiotic, whenever are consumed, they will produce postbiotic. Now don't be confused that what is pro, what is pre, what is post. Post means what? After. Pre means what? Before. So you can expect postbiotics means after consuming, whenever you are consuming something, it will be metabolized in your body if you are having a good metabolism. So after metabolism, obviously they will synthesize something. Whenever we consume anything, like any food material, if you are consuming it, let's talk in terms of nutrient. If you are consuming carbohydrate, then this carbohydrate will be broken down into simpler food, simpler nutrient. So these are the metabolites. So whenever you are taking probiotic or prebiotic, so after consumption, what they will in which form they will be converted. So this is known as postbiotic, and they will then normalize all your inflammation and whatever things which are going on in your body, they will just heal that. So inanimate microorganism and or their component will be synthesized as the post. So now nature is living organism, bacteria or yeast, and non-living dietary fibers. Both living probiotic and non-living prebiotic as symbiotic. And what are the mechanism of action? What they do? They add the good bacteria to the gut. In probiotic, we take good bacteria in our gut directly, and they are providing the condition for the good bacteria to grow. Wait. Hello. Hello. हाँ हाँ दादा, एक मिनट. हाँ. Please wait for just 2 minutes. I have to take my RO water, so please wait for 2 minutes. वो लीक तो नहीं होगा ना? नहीं, वो पूरा कल रात में लीक हो गया था, फिर मुझे सुबह उठ के क्लीन करना पड़ा था। अच्छा ठीक है, ओके। Okay, sorry for interruption. So, okay, back to examples. So we can have Lactobacillus, Bifidobacterium, and Staphylococcus boulardii as the probiotic. So you can expect different bacteria which are good for our gut will be taken as a probiotic. And in prebiotic, we can have different kind of food which will increase the growth of the good bacteria. And in symbiotic, we will take what? We will take probiotic and symbiotic together, probiotic and prebiotic together. So you can expect that we are having different thing in the market, which will be acting as a protective mechanism if anybody has lost their natural gut microorganism. So you can expect that if you are taking probiotic, if you are taking prebiotic or symbiotic, then they will revert the whatever damage had taken place in your gut. So like you can expect the decrease in the population of the bad bacteria and increase in the population of the good bacteria. So these are some of the examples which are taken as probiotic and prebiotic. In prebiotic, inulin is taken. Inulin is what? Inulin is a polysaccharide, naturally occurring polysaccharide in so many different kind of plant. So these are the class of dietary fiber. So you can expect that these are all the options available in the market. So FOS is what? FOS is fructo-oligosaccharide, again a dietary fiber, gluco-oligosaccharide. So all these things are what? They are mostly, prebiotics are mostly dietary fibers. Like you have nowadays, whenever we scroll Instagram, we used to see so many different kind of prebiotic supplement, like plant-based dietary fibers, and so many things. So we don't have to really rely on all those things, because you have to just take care of what brand you are taking, because you cannot go for each and every brand which is which they are promoting it by different celebrities. So anything which is not organic or without observing or going through the ingredients, you cannot take anything blindly. You need to check out, as you are educated enough, you need to check out what is inside the packet, because nowadays every manufacturer makes a packet very decent and very shiny, so it looks like very decent, so you don't know what is inside the packet. So uh, everything that glitters is not gold. So take care of all those things. We need to check out the ingredients and their concentration, because as per FSSAI and FAO, FDA, so it is mandatory that they have to provide the ingredient list in the on the packet. So check before using anything. So these are some of the examples available as the prebiotic, probiotic, and symbiotic. Now sources. So these bacteria can be taken from the yogurt, kefir, kimchi, probiotic capsules. Capsules are also there, consisting of different live bacteria. And in prebiotic, people say eat garlic, because garlic is anti-inflammatory. Why it is anti-inflammatory? Because they have some bioactive molecules in them which will increase the growth of good bacteria and will decrease the growth of bad bacteria. Onion, banana, asparagus, whole grain, all these things are rich in dietary fibers and bioactive compounds which will directly target your bad bacteria and therefore bringing down the inflammation level in your body. I have discussed about this fortified supplement. So nowadays fortified supplements are the good option, but they are costly. Obviously they will be costly because they are unprocessed, they are not rich in flavoring agent, chemicals, and anything. no adulteration, so obviously they will be costly. Now health benefit is they can restore your natural gut microbiota, and they will obviously reduce the infection, and they will modulate your immunity in terms of providing anti-inflammatory condition. And in this, it will improve the digestion, it will enhance the gut flora, and it will increase the short chain fatty acid production. And in Synbiotic, gut health will be improved, and it will provide enhanced probiotic survival. Because it is not necessary that if a person is consuming probiotic, because in probiotic we are consuming microorganisms. So if a sensitive person is consuming it, it is not necessary that he or she will digest it completely, and no such response will be generated. You cannot say that, because in patient having allergy thing going on in their body will react massively towards the microorganism. So your doctor always recommend you something like, if this is harsh antibiotic, they will recommend something together to eat, or they will say that eat this uh, anti-acidic medicine before taking the harsh one. So that all it depends on the whether the person's immunity is capable of tolerating such live microorganisms or not. So whenever you are taking Synbiotic, in Synbiotic we take something which will improve, or which will make our live microorganism to stay in the person who are immunocompromised, who are not having great immunity in their body. So it will be helpful for them. Now, for what reason they are prescribed? If you are suffering from IBS, if you are suffering from diarrhea, if you are having antibiotic associated dysbiosis, then you will be recommended probiotic. Now, if you are taking prebiotic, so what are the condition in which prebiotic is recommended? So prebiotic is recommended obviously during constipation. Whenever you are complaining about constipation, your dietitian or your medical practitioner will say what, or your doctor will say what? Try to have more fiber in your diet. He or she will say that try to have more fiber in your food. So food is more fiber means we are taking dietary fibers. So all those dietary fibers are responsible for treating the constipation. They will cure all the symptoms caused due to constipation and different metabolic disorders. They will also boost your immunity. And mechanism of action of probiotic is they introduce new microbes in your body, so that they can bring down the composition or the population of bad bacteria, and they feed resident microbes. It means they are responsible for providing nutrients for the microorganism growing in our gut. So whenever we are hungry, whenever we are starving for so long, we are making the population of good bacteria, we are declining the good bacterial population in our gut. So if we are consuming dietary fibers in our diet, and if we are taking food at a appropriate time, and if we are taking balanced diet, then we are providing good nutrients for the good bacteria to grow. So whenever you are starving for so long, you will feel bloated, you will feel acidic, you may have stomach ache, and likewise. So why these symptoms occur? Because the gut microbial population needs nutrient to perform their metabolic machinery. So you can expect that whenever you are starving, the bacteria will not be able to grow properly. Now, Synbiotic. So in Synbiotic, we have synergistic effect, that nourishment, it will provide nourishment also, it will provide colonization also. Nourishment through prebiotic, colonization through probiotic. Because in probiotic, we are providing microorganisms. So they will reside in our gut, they will maintain the healthy intestinal epithelial cell, they will maintain the tight junction so that each and every cell will be hold tightly, they will not be in a leaky condition, nothing will be leaked out, everything will be in a good homeostasis condition. So this is an overview of probiotic, prebiotic, and synbiotic. So this one also a diagram. Prebiotic means live microorganism that confer a health benefit on the host when administered in adequate amount. Now, prebiotic are substrate that are selectively utilized by host microorganism conferring a health benefit. Suppose this thing is based on what? Whatever a microorganism prefers to grow. So these things are already known by a microbiologist that this bacteria needs, bacillus needs this. Pseudomonas, like Pseudomonas needs what? It needs a very high amount of glucose source. Without a high amount of glucose source, you can expect the decline in the growth of Pseudomonas. So whenever we work in our lab, we enrich the normal basal media with high amount of glucose, like 2% glucose per liter. So you can expect that every microorganism have its own nutritional requirement, and for that there is a term known as selective media. Selective media means that will only allow the growth of a particular bacteria and not all the bacteria. So NB is not a selective media. Nutrient broth is not a selective media because it will allow the growth. This is the most generalized, most cheaper and most easily available nutrient broth we are having in every microbiological lab, which supports the growth of each and every microorganism like bacteria existing on this earth. So this treatment, this prebiotic recommendation depends on what your microorganism needs, what type of nutrient they need. So if they need high fiber, so you have to increase the dietary fiber option in your food. So your dietitian do what? They understand the whole whatever reports I have shown to you, this one. So through this, your dietitian will do what? He or she will analyze that yes, in his or in her body, the population of firmicutes is higher. So I have to provide something which will bring down the population of firmicutes. So if uh, they are observing that you are not having adequate amount of vitamin synthesis or the short chain fatty acid production, so accordingly they will provide you the nutrition. So if you are having constant constipation, so what they will recommend? They will recommend prebiotic. So whatever microorganism is residing in your body, so if it is above the required amount or below the required amount, accordingly you will be recommended probiotic, prebiotic or synbiotic, because synbiotic is a combination of both. The synbiotic are recommended to the patients who are having a low immunity, because it is not possible for everyone to digest each and every probiotic directly, because we are consuming microorganism, although they are not harmful, but our body treat it as a non-self. So to minimize that reactiveness towards the good bacteria, so they are recommended with the prebiotic, because prebiotic will do what? Prebiotic will provide the exact, or the, you can say the correct nutrient what the bacteria prefers. So if they are providing the required nutrient, so it will not cause any kind of cross reaction or any kind of allergic reaction. And then if you are consuming this prebiotic, probiotic, then you will have a postbiotic compound produced by the microorganism, because just I said, if you are consuming something, they will be broken down into something, or they will be manufactured into something else. So these are the compound produced by the microorganism released from food component or microbial constituents. Because why these two things? Because food components means prebiotic, microbial constituent means probiotic. So they include non-viable cells that when administered in adequate amount promote health and well-being. So all these things will do what? They will help you in every possible way. They're gonna not harm you in any way. So if you are consuming but this also has a certain limit. You cannot take probiotic like if you are consuming harmless bacteria, so you can consume 1 liter a day, 2 liter a day. No, there are some limit. There are some recommended limit that you can take this much amount per day, because an excess of anything is harmful for our body. Our body cannot take that much amount of microorganism or that much amount of drug in our body, because obviously we are having a cell We are having cells in our body. So each and every cell has a definite amount of metabolic role to perform. Not every cell is capable of doing every function. So every cell has a definite thing to perform. So they are just advised that they can take only this much of nutrients. So if we are providing more than that, then obviously we are providing a inappropriate condition, and accordingly our cells will react, and then we can expect inflammatory responses. Now, health benefits imparted by probiotic. This is a collective. I have discussed this, but what prebiotic do, what postbiotic do? Let's have a quick look. So the probiotic do what? The probiotics means microorganism, live microorganism, fighting allergies and respiratory and urinary tract infection. They are anti-cancerous. They are the preventions of cardiovascular disease, hypercholesterolemic activity, anti-inflammatory, immunomodulatory effect, relieving lactose intolerance. Yes, the people who are having lactose intolerance can also consume the probiotic. And also gut health improvement, treating diarrhea, IBS, IBD. For this only the probiotic is provided. So obviously they will cure that thing. And prebiotic, which we take dietary fiber. So in dietary fiber, what they do, weight loss by increase satiety feeling. It is very normal thing. Whenever we want to lose weight, we stick to the uh, high fiber rich diet, like we stick on salads. So after eating a lot of cucumber, after eating a lot of fiber rich food, we feel heavy. Heavy like we, our satiety is fulfilled. So uh, after eating fiber rich diet, we can expect a great weight loss in our body if we are consistent. It can also prevent cancer because it will promote the growth of this one. So whatever be the benefit of live microorganism or probiotic will also be the benefit of prebiotic, because they are supporting the growth of microorganism. So they are laxative means if you are suffering from constipation, then your doctor will recommend you laxative. So enhanced mineral bioavailability, because we are consuming different nutrients. So they are providing you the important and the correct minerals required by your body. So the prebiotic and probiotic will do what? They will improve the survival of probiotics during passage through the upper gastrointestinal tract. So as I was saying, that if you are consuming probiotic solely, so it may be problematic for somebody. So for that, it is always recommended to have some prebiotic along with the probiotic, so as to cut off the chances of cross reaction or any kind of, you can say, side effects of the probiotic. So health advantage from live microbe that may ensure from prebiotic alone. So if you are taking probiotic alone, if you are taking prebiotic alone, so it is not a good option. We have to take both in the appropriate amount. So stimulation of probiotic growth by prebiotic component. So this I was talking about. Yes, this point. So if you are not, if you are eating probiotic only, so suppose what will happen? Microorganisms, live microorganism you are enriching in your gut. So if they will not get nutrient, will they able to divide from one cell to two cell? No. So they require nutrient for that. So therefore our doctor recommend that along with the probiotic you have to take the prebiotic also. So this is the concept behind taking prebiotic and probiotic together, and that is known as the symbiotic. Now some more detail. So the term probiotic is derived from a Greek word meaning for life and used to define living non-pathogenic organism and their derived beneficial effect on host. So we know that obviously if we are consuming it, they are harmless. They are non-pathogenic. So we cannot eat pathogenic bacteria. We cannot even think of it. We cannot even touch it with our bare hands. So the term probiotic was firstly introduced by Virgin when he was studying the detrimental effect of antibiotics and other microbial substances on the gut microbial population. So he observed that probiotica was favorable to the gut microflora. So it was a little bit of history that how it was discovered and all those things. So it is not that important. But the latest definition put forward by FDA and WHO is live microorganism which when administered in adequate amount confer a health benefit to the host. And nowadays people are aware that they can also take probiotic, because if you talk about 2 to 3 decades before, nobody knows about the probiotic. So nowadays people are aware about their health, they are consuming the food which will promote their health. So this is a good thing, uh, but still some awareness are required, because we cannot have a control on our taste. We always require some tasty food. We cannot rely on to the healthy food 7 days a week. So we have to take care of what we are consuming by looking at the ingredient mentioned on the packet. So as per FDA and WHO, live microorganisms are good for our health because they promote the metabolism of our body. They boost up the normal metabolic machinery of our body, and they are responsible for the synthesis of short chain fatty acid and different microbial metabolite, which will in turn do what? It will bring down the level of with level of inflammatory responses, and also they will bring down the population of bad bacteria. They will bring down the population of this bad bacteria. So we need to take a, a good amount of probiotic, prebiotic together. We cannot take only probiotic and only prebiotic. So some of the popularly used probiotic microorganisms are lactobacillus. Mainly they are of lactobacillus genus, lactic acid bacteria group. So lactobacillus, rhamnosus, bifidobacteria also, and different species of lactobacillus. So lactobacillus bulgaricus, acidophilus is widely present in our curd, which we used to eat on a regular basis. So Bacillus coagulans, E. coli, Enterococci, and Enterococcus fecum. So all these things are, and in yeast, Saccharomyces. So all these things are the widely known or popularly used probiotic, and they are not um known to cause any kind of disease in our body unless they are mutated. In science, we cannot use always, because we know that always there is an exception. So if you are consuming these live microorganisms which are not at all mutated, because whenever a good bacteria, if there is some mutation going on, then you cannot say that it will not be harmful for our body. It may or it may not. So all it depends on that whether the strain is not whenever we are keeping bacteria for longer in our lab, like let's say if you are working in your first year of PhD with some strain, and if you have not revived it properly, if you have not kept in a very sterile condition, or like if you are not maintaining the subculturing of properly at a right time, so you can expect at your fifth year PhD it will have some alteration in its genome. This is possible because every time whenever we do experiment in our lab, my PI never allowed to do blindly. He always told us to do the sequencing part. Suppose sequencing of the 16S rRNA to so as to identify that whether this has not altered. If you are working with Pseudomonas, so my PI always told us to go for sequencing each and every time. Like every month, he told us to do the sequencing. So it is quite annoying also that why we need to sequencing, but this is a science fact. This is a very what to say, this is the conceptual thing. Like if you are maintaining any bacteria despite having sterile condition, despite keeping it in a very sterile nutrient media plate and a plate, but it is a bacteria, it is a living organism, it can be mutated at any time, you never know. So we always do sequencing and we confirm that yes, this is the 16S rRNA sequencing, whatever we have got in our earlier studies. So this is a good thing, that you should always confirm that whether you are using Pseudomonas and actually it is Pseudomonas, because many a times people do blunder. They say that this is Pseudomonas, and if people will do 16S rRNA, it becomes something else, Bacillus. So this is a very unethical thing. People are doing this. So don't do such thing, because in research some ethics are there. We need to follow those ethics, because whenever we are committing such mistakes, not we can say mistake, those are unethical things which are going on in some lab. So everything has a option. You can take each and every measure so as to confirm that whether you are using correct bacteria or not, whether its genome is intact or not, whether some mutation is has or not. So you need to take care of each and everything while performing any experiment in your lab, because if you want to do just for publishing a paper, you can publish it, nobody will look into it. But if you are doing this in a such a reputed lab, or if you want to teach somebody else that these are the things you need to follow, so if the person is educated enough, he or she will caught you that you are doing the wrong thing. So whenever we work in a lab, so we need to get learn so many things. So always try to write it down in a notebook, because always maintain your lab record, not for your PI, not for your laboratory record, but for you. So for me also, I have been in research till like 7 to 8 years are there, but I still manage my lab record. I used to write each and everything, like what are the things I have to do, how I used to do. Like I have to do the fluorescence microscopy. For that, I need to put cover slip in a oblique manner. So I always put this diagram in a microwave plate. I used to make this kind of slant. This means I have to keep my whatever be the cover slip in a slant position, in a oblique position. So you need to maintain it like a kids. You need to mention each and every detail, because if you are remembering this now, but after 10 days, after an year, you don't you will not be remember anymore all these basic things. So we have to always maintain our lab record, because these are the assets for the researcher. Because I still have my PhD notebook. Like there are so many parts, because obviously a PhD research is not a like 1 or 2 month research. So we do a lot of experiments, we do a lot of repeat, we do a lot of reagent thing. So each and every concentration of reagent, each and every condition, like whatever be the minute thing, we have to take the supernatant, we have to take the intermediate layer, what we are doing. So try to draw, try to include each and everything. So these are the ethical things which we learn in our coursework, but people never follow. People have to submit their thesis and just add the doctor title. But this is not the good thing to do. So we are putting our 5 to 6 days, sorry, 5 to 6 years. So why we are wasting it? So these are some of the things which I always used to include in my whatever talk I am giving to anybody, because I don't think that we only have to focus on to the this part. Like I will come and I will teach you what is probiotic, what is prebiotic, but whenever it is required, so I used to put my own real experience, so that people will understand that what are the things going on in research. So whenever you will maintain a good lab record, it is very good thing. So you have to always maintain 2 lab records, one for the lab, because those are the lab assets, but for you also you need to maintain a diary in which you will put each and every detail, like right from the aim, how you have done it, the materials and method, what are the result. If it is a negative result, also it is a result. So these are the things which you need to follow in order to have a ethical and a good research. So we have to take care of the strain of the probiotic which we are consuming. If you are consuming a mutated strain, then we are in a trouble. We can be in a trouble because the mutated strain may have some genes which will be harmful for our body. They may can synthesize different kind of endotoxin, LPS. So we need to take care of what we are consuming. So the industry who are involved in this probiotic formation always do quality check that whether these strains are pathogenic or not, whether they have mutated or not. So there are so many quality check. There are so many quality check, and after that they are given the green signal that yes, they are safe for consumption. They will be labeled as safe for human consumption, because all these things are very very sensitive. If a immunocompromised people will take it, you may have some fatal consequences. So these are the things associated with the expiry date also. If you are consuming an antibiotic whose expiry date is already gone, so if you are healthy enough, you will not, may or may not have some fatal consequences. But if an immunocompromised people is consuming, so they will have some uh, very bad consequences out of it. So all it depends on whether the bacteria is wild type or mutated. So not it is always that mutated is always harmful, but you never know. You cannot rely onto the mutated strain. So these are the things which you need to study in the probiotic, like what you are consuming. So probiotic product may contain either a single strain or a mixture of two or more strain. Like VSL3 is a mixture of 8 different probiotic strains. So these are the important part of probiotic. Now probiotic effects are very strain specific and cannot be generalized, because we are consuming microorganism. Every microorganism will synthesize their each and every product specifically. A will synthesize something different, B will synthesize something different. So the effect of probiotic is not generalized. All are specific because we are taking specific strains. So a single strain may exhibit different benefit when used individually and in combination. So the benefit of a probiotic formulation also differ with the patient and group, because everybody has a different requirement, because everybody have the different condition of their gut microbiome. If I have something different composition, you will have something different composition. So we both will be uh, prescribed different probiotic and different concentration also. So we will continue the prebiotic tomorrow. So these are the criteria. We will continue this in the next class, like Monday. So these are the symbiotic, fecal matter transplant. So everything is very interesting. You will be able to know that what is fecal microbiota transplant, why is it done, how is it done, what is the mechanism of action. So everything we will cover in the next class. So let me stop the recording. So this was all for today. Are my slides not visible? But I think it was visible. Is it so? Let me know. Anybody else that my slides are not visible? I have now stopped the recording because the class is over. Okay, so take care and good night.
Ma'am, next class is Monday.